There's a new surgeon in town, and he's bringing new techniques in hand surgery to the Quad Cities. Dr. Ryan Graybo is a Mercy One Genesis surgeon who specializes in no sedation surgery for carpal tunnel syndrome. Thanks for coming in.
Well, thank you for having me. I appreciate it.
Yeah, it's going to be interesting. So first, for those who don't know, let's explain what is carpal tunnel syndrome.
Certainly, very common question people have all the time. Carpal tunnel syndrome is a problem where you have numbness and tingling in your hand, thumb, index, longer middle finger, and a little bit of your ring finger. Tingling may be a sensation of pins and needles in your fingers. They may be completely numb where you drop things. We try to pick up things or try to use your buttons. It's hard to do that. And some patients even have significant pain in their fingers and in the wrist region. But you don't always have to have all those symptoms.
Okay, and so what is the fix for the problem?
So in carpal tunnel, if you see this in here, this yellow band, that's actually your nerve. That's a demonstration of it. And this gray band, that's the band that presses on the nerve. It's not caused by activities. You didn't cause your carpal tunnel. For most people, they'll think, oh, I was typing or writing. That's not the case. If you are prone to it because you have tighter anatomy, yeah, crafting or doing manual labor or other activities may bring that on, but that's not the cause. So how we fix it, it's just like letting out a pair of pants if they're too tight, or Thanksgiving's coming up. After we eat, we unbutton our pants and feel much better. That's what we do with the surgery. We cut this band and it releases the pressure on the nerve.
What a great analogy. But what you're doing is no sedation procedures,
Exactly.
so explain how that works.
Right, so I've been doing this since 2006, and I do lumps and bumps, cysts, all these type of procedures in the office under local. One of the reasons Mercy One Genesis recruited me is they're putting together a team for a higher level of orthopedic care here in the Quad Cities. It just hasn't been available. Obviously, orthopedic specialists is partnering with them, and those guys have been leaders in robotics and spine surgery. We even have a triathlete now who's competing in Spain in the Ironman, and she's our only fellowship-trained sports medicine surgeon. So they needed someone to bring up the area in hand, because we just don't have someone who does these procedures. We have good hand surgeons, but they're not at that level that Mercy One wanted to be able to offer the Quad Cities. So they recruited me for doing the fact that patients with trigger fingers, lumps and bumps, cysts, all of these type of procedures, you don't have to go to sleep. We use a technique where we use local anesthetic, numbing medicine, and I focus on patients' relaxation. That's my specialty.
Yeah, because you don't want them moving during that procedure.
Oh no, but patients are think about reclining at a pool or at a beach. You're in a reclining setting, you're watching a little video on a little iPad. We curate, it's usually nature, relaxing videos, and we're chit-chatting while we're doing the procedure. Literally, our conversation here, we could have this conversation while I'm looking at the machine doing it. You don't even notice I did the injection. You don't even notice I'm halfway done with the procedure. And so patients who otherwise would have to stop their blood thinners, stop medications, that have to get medical clearance to go to the operating room, to go to surgery, they don't have to do anything. It's like going to the dentist. So that hasn't been available in the Quad Cities until now, and that's thanks to Mercy One Genesis.
All right, we're almost out of time, but you also use a couple of other techniques, endoscopy and ultrasound. This is an ultrasound machine?
Correct.
How does that work, or how does it improve outcomes?
So what's great about the ultrasound is it's kind of like being Superman. I put this on your wrist, I can see inside you, so it's a pretty neat trick. Regarding ultrasound guidance, this device was invented up to the north, our neighbors at the Mayo Clinic. This allows me to put this device in through an incision as small as a Tic Tac. This picture here, so I just put this picture here, that little white dot, that's a Tic Tac. The incision's half that size. The reason we're able to do it without going to sleep, without having to stop any blood thinners or anything, is because we can guide this device through that tiny little hole right to where this band is, keeping in mind exactly where the nerve is, and then once we do that, little balloons pop up, and then the little knife comes out and cuts the band, and it comes right out.
And see it through this instead of having to make a big incision.
This allows my patients to be active the next day. My seniors who use walkers, canes, and crutches, they can leave the hospital doing that. My people who take care of their wives or husbands or children, the next day allowed to do it. Most people are back to work or crafting or farming or activities in 3 to 6 days. A lot of people, it's the next day. People playing pickleball 2 days after the procedure.
Yeah. Well, you're obviously very enthusiastic about this, and we appreciate the the education and all the props. Thank you so much for coming in, Dr. Graybo.
My
Graybo with
Graybo.
Mercy One Genesis.
Yeah, and follow us on Facebook. We'd be happy to answer any questions your viewers may have. They just need to go in. If they direct message us, I answer questions on hand surgery, hand problems, as well as my colleagues from everything from shoulder to fingertips and all the way from hip to toes.
All right, thanks again.